Diabetes Connections is brought to you by One Touch. Every touch is a step forward. By Dexcom, take control of your diabetes and live life to the fullest with Dexcom. By Tandem Diabetes Care, makers of the t:slim X2 insulin pump. And by Real Good Foods, real food you feel good about eating.
This is Diabetes Connections with Stacey Sims.
This week, meet Laurian, a labor and delivery nurse now raising 3 children of her own. She was diagnosed with type 1 in 8th grade, and she used to be our babysitter.
I don't ever picture, I think, where I am now. I think I dreamed it, and I wanted a big family, and I wanted my own children, but I didn't know I would be this lucky and healthy to be able to do all this, especially at the very beginning of being diagnosed.
We'll get Laurian's perspective as a nurse, a sitter, and now a mom. In our community connection this week, a mom of 2 sons with type 1 has a book to help others on the journey. We'll talk to the author of Sweet Genes. And in our Tell Me Something Good segment, it was T1D Day at the Georgia State Capitol, and diabetes comes to your Xbox? This podcast is not intended as medical advice. If you have those kinds of questions, please contact your healthcare provider. Welcome to another week of Diabetes Connections. I'm Stacey Sims, your host. We aim to educate and inspire about type 1 diabetes by sharing stories of connection. If you're new to the show, welcome. Really glad you found us. My son was diagnosed with type 1 12 years ago, right before he turned 2. My husband lives with type 2 diabetes. I don't have diabetes of any kind, but I have a background in broadcasting. I worked in local radio and television news for many years, and that's how you get the podcast. Now, I am taping this episode a bit earlier than I usually do. Usually there's only a couple of days before you hear it. But we are heading out of town. We'll be taking the kids' spring break and ending up at the Children for Diabetes Friends for Life conference in Seattle, which, as you listen, has happened a couple of days ago. So I'm sure there will be lots of stories to report in the weeks to come, and I'll bring you up to date and maybe some interviews from there as well. But I was so excited to talk to Laurian. We have had, as you can imagine, a lot of help on this journey. I don't know how you do it without any help. We've been blessed and lucky to have a great support system. And Laurian was one of the people who helped us along the way. And with her experience, I mean, the babysitter part is fun, but it's her experience really as someone who was diagnosed as a young teenager, grew up to be a labor and delivery nurse, and as you'll hear, helping other women giving birth who have type 1 diabetes themselves, and then going through 3 pregnancies, 3 healthy little girls now. And she has some really good advice and some great stories. More with her in just a bit. And boy, it was great to catch up. But first, Diabetes Connections is brought to you by Dexcom. And I want to talk a little bit about Basal IQ here. This is the Dexcom G6 tandem pump software program. We are doing less work for better results. I mean, should I say that again? Less work, better results. With diabetes. Benny liked seeing his CGM on his pump, but that was really a cool feature. It wasn't really very useful for us, I'll be honest with you. He looked at his phone a lot more, but there is something in the Basal IQ that keeps Benny more steady. I mean, I knew it would help with lows, but his time in range has increased significantly since we started Basal IQ. His A1C has come down. It's been really interesting to watch, with fewer lows. I mean, really, I think 1% in the last 3 months, which for us, I'll be honest, we didn't struggle with a lot of lows, but it's amazing to see the difference. Of course, individual results may vary. To learn more, just go to diabetes-connections.com and click on the Dexcom logo. My guest this week just marked 20 years with type 1 diabetes. Diagnosed in 8th grade, Laurian Lane is now all grown up and has a family of her own. This is a personal one for me, as I have shared. I wanted you to hear from Laurian because of her experience as a teen with type 1, because she became a nurse, because she has 3 kids now. But as I mentioned, Laurian was one of our lights along the way. She was our babysitter when Benny was very young. I think she came into our lives when he was 3 or 4 years old. I mean, he was tiny. And today we're going to talk about all of that and so much more. Laurian, thank you so much for joining me. It is so funny to talk to you in this formal way when years ago it was like, here are the kids, see you later.
Well, thank you for having me.
I'm so excited to have you on the show because just like so many people have kind of followed our journey, I've known you not since the beginning, but since before marriage, before your 3 beautiful children, so I've kind of watched you go through all of this.
Yeah.
So thank you for talking to me and sharing this. Let's back up though. Okay. So tell me when you were diagnosed. You were in middle school.
Yeah, I was in 8th grade, 13 years old, March 5th. A crazy time of life, but it definitely put a change in what I thought my middle school years were going to finish as.
Do you remember what happened, how you were diagnosed? Were you sick for a long time or suddenly?
It was a little bit of both. I had been really tired and sleeping a lot. I had been taking a photography course, and it was one of those that you could take and make the photos. So it was a dark room. I was literally falling asleep in the dark room, but I just thought I was tired. And I was drinking a ton of fluids, but not really paying attention to that. But of course it was juice. And then one morning I woke up to make pancakes for my family, and I passed out. Of course, I wake back up I get back up and I tell my parents. My dad says, "Well, are you going to play in your soccer game later?" And I was like, "Of course, I feel fine." So I go to the soccer game, and my best friend's father, my mom and him were talking at the game, and she was telling him a little bit about what was going on. And he said, I did look a little dehydrated, which she found interesting considering how much I was drinking. And she also was telling my grandmother, my dad's mom, who was a nurse practitioner, all my symptoms. And my grandmother told my mom to keep an eye on me for about 24 hours and see what I did and report back. And all I did for the next 24 hours was sleep and get up to pee and drink. And that was on a Saturday and into Sunday. My mom went to teach Sunday school at church and told my sister to watch me. And when she called back, because it was before cell phones, so she called from the church, and my sister told her that I was kind of not really waking up that much. My mom rushed back. They took me to urgent care, and they checked me for mono and checked my blood sugar. And I think checking my blood sugar, I was 900. I mean, it was super high. And they called Baptist Hospital and sent me, it was quicker to get me there via the car than an ambulance. And I just remember driving, passing, like I remember the drive kind of, and all I remember is asking my mom, I figured, well, I'm sick. Maybe she'll get me like a McDonald's milkshake or something, because we never were allowed that.
Typical kid.
Right?
What can I get out of this?
So I asked, and I remember asking for that, and my mom was like, "Oh, not right now." She drove on, and they got me in a wheelchair into Brenner's Children's Hospital. And from there, I mean, I think I already had a room set up in the ER. They were waiting for me. I was going into DKA, and they pulled me out of it, and I didn't have to go to the ICU, which was very nice. Wow. But I did about, I want to say it was like 3 to 4 days in the hospital.
Wow. So at age 13, when they came in and said you have type 1, or I guess in 2000 they probably said you have juvenile diabetes, did you know anything about that? Did it mean anything to you?
Only from the Babysitter Club books. I can't remember.
No, that's so typical.
It was. And all I remember is thinking, well, I'm not going to be able to eat cake at my wedding. I don't know why that was such a big, I was 13. But I was like, what? I can't do this. Like, this isn't going to work. And it was back when they had us mixing NPH and Humalog in the same syringe. So my mom had to, you have to have somebody check over every time you give a shot. Yeah. So that was not fun.
Yeah, but 13-year-old wants their mother watching them do everything.
Yes.
Oh my gosh. Did you go back to playing soccer? Did you get back into the swing of things? Or, I mean, I'm sure it took a while, but.
It did. I was running track, and it was a little bit hard because I had lost so much weight. People thought I had become anorexic. And then, of course, I ballooned back up because I got a lot of fluids put on me. And then I came home, and now I had to count everything I ate. And so peanut butter was something that I didn't have to count or calculate, probably because people think you only eat a little bit. My mom would leave the house, and I would just, devour peanut butter. But I was so hungry. And that'll help you gain back all your weight. And that definitely has some carbs in it if you eat it the way I was eating it. But I did. I kind of got back into the swing of things. I had to bring a snack to school. And now I was, I was different than everybody else. I had to have food at school at certain times because of the insulin regimen I was on. And my mom had to go on a field trip with me. She went to my 8th grade going to DC field trip because she couldn't just send me for 3 days or a week. I think it was a week up to DC without her to help measure my insulin. So that was a little different. Thankfully, my friend's mom came with, and so I wasn't the only one with my mom on the trip.
Did your friend have an issue as well, or she was just a chaperone?
She did. She had a staph infection in her leg, and I believe was in a wheelchair. Yeah, she's okay now. But her mom came because of medical stuff too. Were your friends at that time kind of supportive of you? Do you remember having that kind of support? Were they worried? Were they scared? They were supportive. I had a couple friends come to visit me in the hospital, some of my best friends, and that was nice. But I didn't tell a lot. Like, I think it got around through the grapevine, but I wasn't big on sharing. I didn't like to do my shots in front of anybody. I didn't like to check my blood sugar in front of anybody. I was much more private than I am now. I mean, I guess it's being 13 and being different. You don't want to be different. People were very supportive when my good close friends knew, and everybody was very helpful. My friends always knew. I had a purse with me that had something in my purse to bring it was cake icing. I have friends that even still remember they would carry cake icing in their purses and pull it out if I needed it. But of course, I didn't want anybody else, all the other people, to know that I had diabetes and had to do all these things. Right back to Laurian in just a minute. But first, Diabetes Connections is brought to you by OneTouch. OneTouch has been a trusted brand in blood glucose management for more than 30 years. This past year, Pharmacy Times and U.S. News & World Report named OneTouch as a #1 pharmacist-recommended brand in blood glucose monitoring devices based on a survey of pharmacists nationwide. Find out more about OneTouch brand products at diabetes-connections.com and click on the OneTouch logo. Now back to my interview with Laurian Lane. When did you decide that you wanted to be a nurse? Did that come before or after your diagnosis? My grandmother was a nurse, actually a nurse practitioner, and I always was interested in it. But really after diabetes, maybe in high school, I liked science. And so I thought, and I loved my diabetic educator that I had when I was about 14 all through high school. And I believe into college. She had babies and
doesn't that it just makes such a big difference when you have an educator that can kind of take you by the hand and understand and guide you and really not judge?
It did. She was amazing. She knew that life wasn't perfect. She knew I was a teenager. She knew I was going to push every boundary I could. And she was able to talk to me like she understood. And so she didn't have diabetes, but she wore all the equipment and tested it all out just so she could tell you how it was going to feel. So I loved her, and I was thinking, maybe I'll go into diabetic education or diabetic. And I loved the nurse practitioner, Bobby Hackman, who was at the hospital and helped me through it in the very, very beginning. She was amazing. She was great with with all children, and she just helped me realize pretty soon you're going to be checking your blood sugar and taking shots like you brush your teeth every morning. It's just going to become second nature. And at the time, I didn't believe her, but of course now it has. It became pretty quickly just like second nature. And she was an amazing person. So I kind of decided in high school I wanted to go into nursing to be like Bobby Hackman, the nurse practitioner at Baptist, and then my diabetic educator, Jennifer White, who was amazing. She was a dietitian and then became a diabetic educator. So I worked at Forsyth, and we saw in Winston-Salem, and they're the only the only delivery hospital within an hour, basically, radius at the time. And they had all the high-risk pregnancies, anybody from Baptist, all the residents were there. So anybody with type 1 or juvenile diabetes, they are high risk immediately. And then you do have a few type 2 pregnant. But yeah, gestational diabetes, being a diabetic, I find that gestational diabetes was a little easier to manage as a nurse. For the patients, it's harder. But you get a lot. I did have a bunch of sick diabetics, and a lot of nurses are scared to mess with insulin and everything in the hospital. But I was thrilled to have diabetic patients, controlled or not
Did
controlled.
they call you? They'd be like, we're not sure what to do. Bring Laurian in.
No, but I did always get them when I was at the hospital as the nurse. They would always be my patients.
It's scary enough to be giving birth, to have type 1, and then realize, okay, my nurse has type 1. This has got to be reassuring. Did you get those kind of smiles and relief? Did people say things? Yeah,
I would have patients that only, I believe, 1 or 2 ever in like 9 years of nursing had the same Omnipod as I do. But it was fun to like pull out stuff and talk about it and understand blood sugars and checking blood sugars and eating. Of course, back when I first started, I had not been pregnant yet, but to just have that same, I've been diabetic since so-and-so years, that was kind of nice. I did have a couple patients that had the same diabetic educator that I had, and just to hear how amazing she was with them too, it definitely made the patients, I hope and believe, feel more comfortable.
Any advice for people with diabetes overall when we go in the hospital? Because that can be very scary, especially as you said, the nurses, whether it's in, delivery room or getting your appendix out, the nurses and doctors and hospital staff have a lot of knowledge, but not a lot of knowledge necessarily about insulin and type 1. Any advice to help us better advocate for ourselves and our family members?
These days, with so many more insulin pumps, I would strongly push for telling the hospital or the doctor or nurses that you want to manage and keep your pump on. As long as you're comfortable and coherent, it's easier for you as a patient to do what you've been doing and let the other things happen. My pregnancies and the patients I would have on insulin pumps, it's just easier for them to manage on their own or have somebody, their family member, to help manage their insulin pump instead of having to get on, let's say, an insulin drip. If you're in DKA, of course you need an insulin drip. But if you're in there for anything else, make sure that the doctor or nurse, you stick up and say, I know what I'm doing, and I would like to wear my pump, because most of the time that's going to keep you better controlled than whatever they have to control you.
Yeah, no, it's a great advice. And I would also add, just from some personal experience of friends, if you are in a situation where the hospital staff is giving you pushback, it's always fair to say, I will have my endocrinologist call, or please call my endocrinologist. And oftentimes your endocrinologist should say, this person knows what they're doing, or mom knows what she's doing. If your endocrinologist will not say that for you, it may be time to sit down with them or to switch. But I would say, as a hospital staffer, I wouldn't imagine you'd be offended by that. I think people sometimes are worried that they're going to say the wrong thing. That's okay, right?
It's totally okay. I mean, there are policies working in the hospital. I know that there are policies, but you're able to get a doctor's order and just say, I was able to get doctor's orders to say they are allowed to manage their own diabetes. Unless you're in the hospital for a diabetic problem, for DKA or something.
Right, or you're unable to care for yourself at all. I mean, we're understanding the parameters here, but if you're there, for outpatient or whatever.
Your doctor should be okay and want to let you take care of yourself, because, as you said, most of the time it is not something that doctors in the hospitals deal with. And diabetes, especially type 1, is a very fine-tuned disorder that you have to know what you're doing to mess with somebody's blood sugars. Everybody's different.
All right, let's fast forward a bit then. Yeah. So you're a labor and delivery nurse. You're delivering other people's babies. You and your husband are ready to start your own family. Personal question, were you nervous about type 1 and getting pregnant?
I was. But more so, I believe, because I was a labor and delivery nurse. I think the diabetes part was so much a part of my life. At the time, with my first pregnancy, I didn't really worry about the diabetes part because I knew too much as a labor and delivery nurse.
Yeah.
I was definitely more nervous with that. Taking it back, if I wasn't a labor and delivery nurse, I probably would have been very nervous about diabetes and pregnancy. So I'm sure being nervous in that sense was all of the above.
Let me reframe the question then. What did you learn from your first to your third pregnancy? You have 3 beautiful little girls.
Thank you.
I just love seeing them growing up on Facebook. But what did you learn or do differently? I'm just saying, if someone is listening, perhaps thinking about becoming pregnant, or a mom of an adult daughter is worried, what did you learn along the way? Any advice?
I learned it's definitely a high-risk pregnancy, but I also learned the world's not perfect. I think I went into 2 out of 3, at least 1 out of 3 of the pregnancies, and my A1C was not perfect or anywhere near perfect. My last pregnancy especially, my A1C, my doctor had said before I came in pregnant, we need to get this back under good control. But I was dealing with 2 other children, and I just was putting myself back. And I got pregnant and was able to get my blood sugars under way, way better control pretty quickly. But I didn't start out my pregnancies with perfect A1Cs. And I thankfully was able to carry 3 healthy children. I mean, you definitely, medically speaking, should be as well controlled as you can be before you get pregnant. But in the time that you might not be perfectly controlled, don't freak out. You can get yourself, if you find out you're pregnant, you can get yourself down into control, especially with a continuous monitor these days.
It's funny, Laurian, I didn't think about this, but we're getting this really nice both sides of the coin here, because you know what you should be doing, especially as a healthcare professional. But at the same time, real life with diabetes is not about perfection. So I really appreciate you sharing in this way. It's really important. A lot of women I've talked to find that they kind of underestimate the changes of insulin use during pregnancy. Did that sneak up on you?
Oh, yes. The first pregnancy, I thankfully was able to keep with my same endocrinologist that I had been with since I was, 16. I didn't live in the same city as him. I thankfully was able to talk to my OB, and I was comfortable with my endocrinologist, and he was a phone call away and an email away. But I saw him once a month. I hope most endocrinologists will see a pregnant patient once a month. My endocrinologist would change my insulin rate. The amount of insulin I was going through by the 2nd and 3rd trimester, I had to change my insulin pump. I'm on an Omnipod, so you can only put in 200 units, and it's supposed to last 3 days. But by the end of pregnancies, especially my 3rd, I was changing my insulin pump every day and a half to 2 days because and by the end of the first pregnancy, I used a lot of insulin, but it wasn't till the 3rd, my body just sucked the insulin in, and I was getting to the point I couldn't eat anything but like salads and as low carb things as I could.
And that's a good point, because when we're talking about the 200 units every 2 days or so, this is not because you're drinking milkshakes. This is because the basal insulin is so high, right?
Oh, yes. It was unreal how much. You don't even think about how much. You can go through so much insulin. At the beginning of your pregnancy, doesn't need that much. And then it was kind of like a light switch would turn on or turn off, depending on and you just needed so much more. But that was okay. And my endocrinologist had dealt with many pregnant patients. It wasn't for bad control. It was just to keep you in reasonably good control.
I know we're fast forwarding a lot of this, Laurian, and I don't want to go through all of the details with you. I know a lot of this is so personal, but you had 3 healthy deliveries?
Yes, I did. Because I'm diabetic, they'll induce you early, and I wanted to be induced. So back in the day, you had a lot more miscarriages or fetal demises with diabetics. So they want to deliver you early. And even when I first started as a labor and delivery nurse back in 2009, they were still inducing diabetics at 36 weeks, which is a preterm delivery. Of course, now with all the studies and everything show, you can go longer. So I was induced at 38 weeks with my first. And it was a failed induction, which means I ended up in a C-section, which how big they were expecting her to be was a lot bigger than she was. Because of diabetes, you also gain and retain a lot of fluid. So I looked quite large. So give or take a pound or two in their growth scans that I had. By the end of my pregnancy, I was going in almost once a week to just check on the baby and see how big she was growing. But I had a C-section and it was great. I mean, it was a great C-section. Everything was fine. They again let me keep my insulin pump on, and they let me keep I believe a G4, because that was so many years ago, my continuous monitor. And the continuous monitor at the time, my doctor wasn't a fan of. I just really wanted it. So I pushed for it, and he was fine with that.
It must have been the G4. I'm trying to think. It's 5 years ago is when we started with Dexcom. And so 5.5, almost 6 years ago with your first baby. Yeah. It was probably the G4.
G4, yeah.
Yeah, and your doctor wasn't on board with it at the time.
So we did a test he didn't think that they were accurate enough. And at the time, they probably weren't. I mean, they definitely weren't as accurate as they are now. But we did a test when I was pregnant. We had one of my blood draws. The lady drew my blood. I wrote down what the Dexcom said, and I checked my blood sugar on my meter. And of course, the blood draw was the most accurate. But thankfully, to prove that it was pretty accurate, the Dexcom wasn't very much off. I don't remember exactly what the blood sugar was at the time, but I will say now being on a G6, it's much more accurate, and it's nice to have it on my phone and not have to carry around.
And they've done studies, and I'll link one up about CGM and pregnancy and how much more better the outcomes are health-wise for women. So good for you for pushing for that.
Oh, back to the pregnancies and babies thing. I definitely, to tell moms who are possibly pregnant or trying to get pregnant, most of the time, even with perfect control, your baby might end up in the NICU with low blood sugar. And that's something at the first hospital I ever worked at, all diabetic babies went to the NICU for 4-hour observation. Because in the first...
You mean all babies born to
diabetic.
To moms?
Yes, type 1, really. And then at the hospital I delivered at, they didn't. However, my first and my second both ended up in the NICU, and both had low blood sugar. And the first one had to be there for 24 to 48 hours, and she was on an IV to try to pull her blood sugar up. And my control was pretty good with her. My second was there more for low blood sugar, but she really was born at 36 weeks. And a diabetic baby at 36 weeks, a lot of times their lungs haven't matured yet. And so she was in there for her lung maturity, she wasn't breathing very well. But she came out fighting 9 days later, and we took her home. And my last pregnancy was a scheduled C-section. My blood sugars were very well controlled. And she had low blood sugar, but I was also said, I don't care. And nowadays, they always push nursing, and moms will come in with birth plans and say, I don't want my baby to have anything. But if you're diabetic, I would suggest looking at your birth plan. And if your baby comes out with low blood sugar, saying it's okay to have a little formula. I would rather my baby have a little formula than have to be stuck and have an IV for pulling their blood sugar up. So my third had some formula, and I nursed her a lot, and she pulled her blood sugar up quick enough that she did not have to go to the NICU. But the NICU might be scary, but it's not. They're very helpful. And all my babies came home.
Good information. Yeah, that's really good information. I had not heard that before.
Yeah, because it scared my husband at the first one, said, when he found out about, when they come and take her, he said, well, does she have diabetes? And I said, no. But he hears them talk about blood sugar issues, and to him, that's diabetes. But I was able to tell him, no, it's just low blood sugar. Babies coming out of a diabetic stomach, have to become adjusted on their own and pull their blood sugar up, which is harder sometimes for them.
How do you handle explaining to your children, and they're still small, but since day one, you have to have found a way to explain to them what type 1 diabetes is, what you need, and that sometimes, I would imagine this is tough, that, if you have a low blood sugar or something, you need to take care of that first. How'd you do that?
Oh, I guess I've always had them around when I change my insulin pump or change my Dexcom. with Juliana, especially now that she's older, I talked to her about it. On Diabetes Day, National Diabetes Day, I was like, we're wearing blue for diabetes. Remember, that's what Mama has. And sometimes, I guess not that often, I'll say, Mama's not feeling very good. I need to get something to drink, or Mama needs to eat something to get my blood sugar back up. I don't think they quite know yet what blood sugar is, but they understand I need to get something to eat or something quickly. I like to just quickly get something and I don't even like telling my husband, or when I'm with my parents, like, I'm low, I need something. I get mean, supposedly. According to my mother and my husband, I'm not a very nice, low person. So they catch on pretty quickly. If I get snappy at somebody, they'll say, Laurian, what's your blood sugar? But with the kids, I just kind of pull away and grab something because I have tons of snacks and food in the house. They see me put things on and check my blood sugar, and they kind of, at least the oldest one, kind of understands. But the younger one will point at it when she sees it on my body. And when she was younger, would try to touch it. And I'd be like, no, don't mess with that.
Well, because as I mentioned at the beginning of the show, we met because you were a babysitter for us, and you met Benny when he was teeny tiny. And, one of the conversations that we had was what happens, if you go low while you're babysitting.
Yes.
And we had this conversation with you, and we had it with our kids. And of course, Leah, my daughter, who's a little older than Benny, was always prepared to help you or any babysitter with type 1. I don't think she ever needed to.
Right.
But it is one of those things where when you have type 1 and you're caring for small kids, it's got to be in the back of your mind a little. You got to be extra prepared.
Yeah, you do. And I definitely remember that conversation that we had. But you're right. I don't think that we ever had, at least with my lows, I'm not incapacitated. I've been on social media pages with other diabetics, and I can see seizures and all sorts of different things people talk about having. And knock on wood, that has not ever happened to me. And I've had some very low blood sugars, but I'm able to grab something and eat very quickly. I have random stuff always in my car. The occasional time I don't, I try to get somewhere really fast and get something. Yeah. But knock on wood, so far I've been able to get situated enough to get something quickly. But it would be scary to have lows that make you have a seizure, or I don't know what I would do. And I would try to maybe teach my 5-year-old quicker how to call 911. I think she knows how, but I would make sure.
Let's talk about babysitting for a moment, if we could. As the person who watches the kiddo with type 1, I know what I ask a babysitter, and I know, advice I've given people about when they're looking for someone. And frankly, my advice is, if you've never heard those shows before, is you don't necessarily need someone with type 1. You need someone who cares and pays attention. Your comfort level in terms of how much your child can do can kind of dictate what babysitter you get. We had a 23-month-old diagnosed, so I was comfortable before diabetes leaving him and my daughter with the 15-year-old teenager down the street. But until he was about 7 or 8 and could check his own blood sugar and really understand things more, we didn't go back to those babysitters. We used fabulous people like Laurian who knew what they were doing. What's your advice to parents? I know you don't babysit anymore.
Yeah.
Too bad. But what should parents think about?
You guys were awesome to babysit for, because you were understanding that he was a kid and it was real life. I loved babysitting for you guys, because it wasn't well, Benny can't eat any of this. It was, he can eat this, but you have to calculate it, which is how I was as a diabetic. So that made it way more comfortable. But I guess I would say, like you said, somebody that's comfortable learning and understanding and won't get scared. If you did have a 30, 40 blood sugar, they understood how to resolve it without scaring the child or without freaking out. Because you need somebody that's got a good head on their shoulders to be able to as smoothly as possible, if they aren't diabetic, understand that they need something quick. You need to get their blood sugar back up, and they're going to be okay most of the time. But I remember Benny one time tore his pump fell off, but you guys had the different pump than I did. And I sat there and I was like, oh no, I don't know how to put this on. I was like, oh my gosh. Like, and that's what something, but like it worked. We worked it out. I believe another babysitter came over and helped me, and everything was fine. And he was very good at listening. And like, you know, he came over to me and goes, "Here's my pump." And I'm like, "Oh no, that's supposed to be on you."
I vividly remember that. And I will tell you from my perspective, we were at a party and I didn't even want to be there in the first place. It was one of these obligatory things.
Right.
And you called and you were like, "Hey, you know, we're okay." And of course, you know, now he would have just given himself a shot and moved on until he felt like changing it or changed himself. But at that time, he was terribly afraid of insulin shots. So we did everything we could to just put new pump sites on him. And boy, did that make it difficult. But we had another babysitter who didn't live far away. And I texted her thinking maybe she could talk you through it.
Right.
And then she was like, "I'm going over."
Yes. And that was so helpful.
We're the luckiest. Oh, we are the luckiest people you will ever meet.
Oh, no, it's definitely.
Oh my gosh.
I now, like looking back, I was so thankful she was able to pop in and help, because I feel like watching her do it, I was like, okay, I could have figured that out. But again, it wasn't me. It was your kid. And so I was like, okay, this is a little bit scarier for me, because I'm not 100% sure. Like checking his blood sugar, I had down pat. But I remember, I think one of the times I spent the night, you told me he'll be okay, because it's before continuous monitors. And I remember you saying, like at the beginning, you were like checking his blood sugar in the middle of the night all the time. And I remember just laying there like, oh my gosh, what if he goes low in the middle of the night? He didn't. We were all good. But that, I can't imagine how hard that is for people with young children, babysitter or mom and dad, because without the continuous monitor, how do you know? But it's interesting, and we could do a whole show about before CGM, because it is such a great tool. But I also think many parents of young children who use it just watch it all night. They're just waiting for that drop to come or something crazy to happen. And, you know, it's so much, well, there's a lot of fear out there. Yes. And we went 7 years without a CGM, and we did not have that fear. Yeah. You know, my endo told me it's okay, and we said okay. Yeah. So, you know, I think it really helps to not have that fear. But, it's somebody else's kid, too. Right. That was a little different. I was a little worried, but, he was fine every other day. So I was like, okay, he will be fine. And everything was fine, and it was great. But I wasn't that young. I was 13. So I'm sure my mom there was multiple times that I know my mom was scared the whole time, but like I remember times that she was scared with low blood sugars, but I was older. So I was a little bit snotty teenager that was going to do what I wanted to do when I wanted to do it. So it doesn't help in diabetes.
Yeah. You know, it's funny. Benny's in 8th grade now, which is when you were diagnosed. Yeah. And, he's a little different. I'm not sure that you would encounter that adorable little child you babysit for.
But I guess all teenagers have to go through that stage.
I guess so. They're so lovely. You babysat for a variety of people, because we found you through a babysitting service, I believe. Yes. I'm curious, and no naming names. It doesn't even have to be diabetes. You have any like wild babysitting stories? Anything ever?
Oh goodness, I did babysit. They tried to get me a babysitter, I think before Benny, that had diabetes, and she was a teenage girl. And she was going through worse of a time that I went through. And they tried to get me to talk to her. And she was worse. I was bad at being receptive to other diabetics and being involved with other diabetics. And it was a hard time to be different. But I did remember trying to have conversations with this girl to say, you can't just not take your insulin. Diabetes just doesn't go away. Yeah. I mean, my mom it was hard. There were days that I was like, I don't want to take a shot today. And my mom had to unfortunately say, well, you have to. But this poor girl, she did. I don't know what ended up happening. I just remember they only was able to babysit her a couple times, and it was just so hard to communicate with her. And I remembered being that teenager, but I didn't have a diabetic babysitter.
You know, you have a big family. You have sisters. You have, I can see on Facebook, I don't know who's a cousin, who's a nephew, who's a niece. You have a big family. You know, there's a lot going on. When you look back at that angry and, obnoxious 13-year-old that you say you were, which I find very hard to believe, do you think you could have pictured this big happy family that you have now? Is that not, you were thinking about your wedding cake.
Right.
Obviously, you were thinking about family at that time.
I was. I guess I don't ever picture, I think, where I am now. I think I dreamed it and I wanted a big family and I wanted my own children, but I didn't know I would be this lucky and healthy to be able to do all this, especially at the very beginning of being diagnosed. I did get to eat my wedding cake at my wedding. It was nice because our wedding planner actually was amazing, and her brother had type 1 diabetes. So that helps my mom and me be more comfortable because she said, I've got this. Like, I know she needs if she'll need something, I'll have something for her. Because at your wedding, you don't want to worry about low blood sugar and your meter. And at the time, I only had a meter and my insulin pump. So she made sure I ate. She was very helpful in that sense because she was a sister of somebody with type 1. So it's always nice now that I'm older and more comfortable. In college, I would give shots of insulin in a restaurant or in a car at a stoplight. Like, by the time I got to college, I was much more open about it. And that, I think, helps a lot. Looking back, I would tell the teenage self tell people, be more comfortable. I know it's hard, but be more comfortable. Like, it is not a bad thing for people to know you're diabetic, and nobody's going to judge you. If they do, they're probably not worth being friends with. But that's what I would tell teenage self and others. Like, people are interested and want to know more about it. Always. Even my patients that weren't diabetic would hear my pump beep or something, and I would tell them about my diabetes. And it was a good learning experience to figure out that other people can know about it and it all be okay.
Laurian, thank you so much for joining me. It's so great to catch up with you, first of all. And I really appreciate it. Throughout our journey, you've been one of the very positive, bright lights overall. I'll be honest, I don't know how much. I mean, my kids definitely remember you, and they remember fun times with you. I don't know that Benny remembers all the details of you showing him diabetes stuff, and because I know you did, and I know you checked blood sugars together and those kinds of things, but he definitely benefited from all of that. So I just cannot thank you enough. Oh, of course. And thanks for sharing your story today.
Of course. Well, thank you for having me.
You're listening to Diabetes Connections with Stacey Sims.
It was so great to talk to her and to catch up. I mean, gosh, she really came in our lives exactly when we needed her. I'll put some more information up about a few of the topics we talked about in the show notes. You can always find out more at diabetes-connections.com. I like to put some information. If you're not familiar, every show has a little, I guess you'd call it like a little mini blog post. Podcast notes or show notes are structured that way, and every podcast app is slightly different. So if you're listening on an Apple podcast app, in iTunes or Google Play, it might look a little different, but they all have a more info or details, and you can always click on that and get more information, or come along into the Facebook group, Diabetes Connections, the group, and you can ask questions and get more information there. I love our group. It's growing and a bunch of great people. And I keep it that way. I'm not afraid to block meanies and things like that on the Facebook community. I should share too that, the way we found Laurian was through a service. We had a lot of babysitters. I was never afraid to get a babysitter. We had always used sitters because I worked full time. My husband worked full time. We had crazy schedules. I worked mornings. He worked nights. We had a daycare center that we used for both children, but I was never shy about hiring a babysitter. We mostly used the teenagers on the block until Benny was diagnosed. And then I knew we needed someone who could do more because he couldn't do anything. We actually went back to a lot of those younger sitters when he was about 7 or 8 and could do more. But if your kid can't check blood sugar, you don't necessarily need someone who's a diabetes expert, but you do need someone that you can teach and is responsible. So we turned to a local sitting service, and that's how we found Laurian. I mean, you talk about luck. That was fantastic. And then we actually used that network. I don't think we went back to the service per se, but we found she was a nursing student. And the light bulb went off. So we found other nursing students and other education majors, people who were interested in working with children. And those people became some of our best sitters. Now, as I said, as he got older, it was less important to me to have somebody who could learn how to check blood sugar and more important to have someone who could supervise him doing it. So there were a lot of ways to find different sitters. I mean, the best way really, if you don't want to call a service or you don't have one near you, is word of mouth. Ask other moms of kids with type 1 or even just other moms for responsible sitters who they have used in the past. There's also a great service through Beyond Type 1 now. They have kind of become the umbrella organization for safe sitting, and I will link that up in the show notes as well. That is specifically for Type 1, but my understanding is that it is not nationwide. So it's kind of luck of the draw if you can find somebody there in your neighborhood. And Maura McCarthy and I have addressed this in our Dear D-Mom segment. Again, more on sitting there. So lots of resources and information, but it was just great to talk to Laurian again. In our community connection this week, we are talking to Susan Sloane, the author of Sweet Genes, a book about her story, her two sons with type 1. Community Connection is brought to you by Tandem Diabetes Care, makers of the t:slim X2 insulin pump. Susan Sloane had her world turned upside down when her son was diagnosed with type 1 as a baby. Then a few years later, her other younger son was diagnosed. That was back in the 80s. Now both boys work in healthcare, and Susan has written a book. It's called Sweet Genes, Finding a Balance, Living with Diabetes. It was great to talk to her. She lives in Syracuse, where I spent an awful lot of time. I hope it has stopped snowing there, Susan. Here's what she had to say. Susan, welcome to Diabetes Connections. Thanks so much for joining me.
I'm excited. Thank you for having me.
Oh, yeah. We'll talk about Syracuse later on and some of the other connections that way. But I want to jump right in and just talk about your book. I want to talk about your boys' diagnosis stories. But what made you write the book? Because your oldest son was diagnosed in 1985. Some time has passed.
Yeah.
Why write it now?
It actually was a culmination. I've been working on it for quite some time, actually, from the inception of when they first got diagnosed. I would write, whether it was for myself or to help educate others, I would always write things down as they happened. The book was forming from way back when, and then I really had to put it together. I think also I needed all the pieces of the puzzle, and for me, finding the right time, and the time seemed right when Jason actually entered a fellowship in endocrinology and really ended up working with the very doctor that treated him at just 17 months old. So for me, it was like, oh, wow, it's come full circle. I need to tell this. And I had all my notes, if you will, whether it was scrap paper, whether it was letters, whether it was just articles that I'd written, and I decided to put it together at that point. I thought it was the right time, and it was very cathartic for me.
So let's go back and talk about that time when your 17-month-old was diagnosed at, frankly, a very different time than when my 23-month-old was diagnosed. Benny was diagnosed in 2006 at a time when toddlers were getting insulin pumps and things were so different. Can you take us through some of the story about, what happened with your family?
Yes. So my husband and myself are both pharmacists, so we had some preliminary education in diabetes. And I later found out that, just that preliminary education that I had was not nearly enough and not nearly what I would need when diabetes came home with me. Yeah, Jason was just 17 months old. It was a hot summer, so he was losing weight, drinking a lot, going through diapers like crazy. And other new mothers at the time would say to me, and I was pregnant with my second child, so other mothers would say, oh, I double diaper, and a lot of the babies wet through. So it wasn't apparent to me right away. And then without going into the long story of the diagnosis, it just actually came to my husband one day as Jason lost more weight and started to get sicker, and my mom had been watching him, and he was throwing up, not eating. And my husband just, for some reason, had an epiphany during a weekend and said, I think Jason has diabetes. And I thought, that is the most ridiculous statement I ever heard. It wasn't in our family. He was just 17 months old. And we brought him to the pediatrician who was our cousin, who also thought that we were just being like over dramatic parents. So he tested the diaper, which is, you never forget some of those moments, and found the strip to have the highest level of ketones and sugar.
Let me just stop you there for a quick second, though. When you say tested the diaper, I think I know what you mean because I think I've been there. How did you test the urine in a child that's not potty trained, right? He's not going to urinate on the stick.
Right. So basically, he had, thankfully, a wet diaper that we brought him in with, and he just, because he was going to the bathroom so frequently, it wasn't that hard to get the wet diaper. It would almost be able to wring it out. There was that much urine in the diaper. So at that point, he just looked at us with, I just never forget, the look on his face, and sending us to the hospital. And basically we were kind of like deer in headlights, and getting the blood work and then getting the admission. And then subsequently, as you said, treatment of diabetes was pretty archaic at that time, with huge blood glucose meters, no mention of insulin pumps. And the physicians, when we got the diagnosis and were admitted to the hospital, my wake-up call was when I was asking a million questions. Of course, he was put on an IV, and thankfully the DKA wasn't so advanced that he didn't have to go to ICU, so thankfully we caught it in time. But I was just asking rudimentary questions like, he likes animal crackers, as does most every toddler, and I had no idea, can he still have those? And the young resident who was with us at the time brought out this huge, it looked like an encyclopedia, and started rifling through the pages. And I thought, if he has to look this up, then I'm in trouble.
Wow.
So I have to really get on my game, and I had to snap out of it. There was a lot to learn. We were basically thrown into it. Even the insulin formulations were pretty rudimentary, ultralente and regular insulin, not even the insulin analogs. And at the time, they thought they were doing their best job to keep his blood sugars between 80 and 120, which now we know is so dangerous for a toddler. And in fact, when we brought him home from the hospital the first night, he had a seizure in his crib. That actually was a result of a chart error, medication overdose, if you will. He was dosed with the wrong unit per kilogram on his insulin. It was crazy, and we were not sent home with glucagon. So the whole experience was pretty wild.
Well, and as you write in the book, which my jaw dropped, you were not seeing a pediatric endocrinologist. When your baby was diagnosed, you were seeing somebody who was not, well-versed, let's say, in the state of the art, and certainly not how to treat a tiny baby. I was amazed by that.
It was pretty wild. It was hard to find one locally, even in the central New York area. Endocrinologists right now are in short supply, but then to look for one who was willing to treat a child, and we did have a few pediatric endocrinologists, one of whom refused to see Jason because he didn't want to deal with any children who had more often than not some diabetic emergencies, and he basically verbalized that to us, which was very disheartening. So we did travel to Boston, to the Joslin Diabetes Center there, where we found the most compassionate pediatric endocrinologist, and he really saved us, basically. But our journey was a tough one because, again, being that the insulin was not what it is today, and when I look at the CGMs and, thank God, all the wonderful tools we have, it amazes me that actually we got through it without that, quite frankly. I'm not there by the grace of God, but yes.
Well, you got through it twice, because a few years later your younger son was diagnosed.
Yes.
Now, was that through TrialNet? Because he was caught before he even had any symptoms, right?
Right. So we were going to Joslin every year for checkups and coordinating with our pediatrician here in Syracuse, New York, and it was working out well, and Mark was growing up. Jason was 17 months old at the time, so I really thought we were out of the woods, so to speak. And we just saw a sign at Joslin. Joslin was, at the time, pretty up on all the studies and really cutting edge, still is. And then we saw the trial being advertised in the elevator that said, if first-degree relatives, if you want to know if you're at risk. And that was hard for me. Like, I just did not know. My husband insisted that we all be tested, and that was a very difficult thing for me to do. I didn't want to think about it, but I'm really glad that we did because it was a timely test. When Mark was 9, his antibody level was very high, and we got the call. As difficult as it is to think about, it was really good that we knew.
It is one of the harder decisions, I think, for parents and people with type 1 to kind of decide if they want to go through with that. We've done some really, I think, not because of me, but we've done some really interesting shows and conversations about, do you want to know, and then what do you do with that information? But I want to ask you is, your mother had some really great insight. I'd love for you to share, because you were very upset and devastated, as I think most parents would be, and she helped you get through that. Can you share what she said to you?
Yeah, it was really crazy because I was just, I was beside myself, upset, crying, just a mess when I heard about Mark's diagnosis. And my mother just reeled me back in and said, you've got to get it together because Jason's been diabetic since he's 17 months old. And what will he think if you are so upset about this diagnosis? And Mark was like a slap in the face. I had to just get back to reality, get back on the horse and say, this is our new normal. We can do this. But she really brought me, she really slapped me back into reality because I thought, Susan, what are you doing? Obviously it was upsetting, but I had to, for the sake of both of them, just create that new normal, which we did.
How did they react together?
Very cute together. It was actually a friend of mine said it was actually almost with Mark a rite of passage because he had seen Jason grow up with diabetes for so many years, and he was used to doing, in fact, sometimes he would even do a blood test without having to, and, that he would have to wait sometimes to eat if Jason's blood sugar was a little higher. And he also knew to give Jason glucose if he felt like he wasn't feeling well. He could tell the signs because he knew his brother quite well. So he fell into it as part of a normal, if you will, because it was in our household. Yeah. So he understood that also Jason could live was living a normal life. He did not complain.
Tell us about when Jason decided he wanted to be a doctor. You said it was because he was talking with his endocrinologist one day. Tell us the beginning of that story.
Yes, he really loved Dr. Woolsdorf, was just so great, and he had such a great manner. And he really, even though Jason was just a child, he always looked him right in the eye and spoke to him during our time together as opposed to just talking to the parents. He really wanted Jason involved to see how he was feeling, and he made him feel important. And that brought Jason into really wanting to have a connection with other patients like himself. It was really pretty cool because now he's, in fact, an endocrinologist. To me, it's just crazy.
That is so wild. It's great. When did he, did he really know as a kid, this is what I'm doing and just stay on that path?
He knew he wanted to be a doctor. We were not sure of the specialty, but as circumstances evolved, he just kind of fell into the endocrinology specialty. And for him, it's been he loves it. He loves treating the patients. A lot of times he said they'll say to him, you don't understand what it's like. This is difficult. There's so much for me to remember, so much for me to do. And then he will actually show them that he's wearing a CGM and let them know that he is, in fact, also diabetic. So it's a very cool connection that he has with his patients.
You both, as you said, you and your husband are in the healthcare field. Your older son is as well. And Mark is too. Is he in healthcare?
Yes, Mark is a pharmacist, and he's a little on the quieter side as far as voicing his feelings, but he really is very good with his patients and has indicated that whether they have diabetes or other chronic diseases, it really helped for him to have the background that he has to be more, he feels that he's a more compassionate healthcare provider because of it. And interestingly enough, the CGM, my son actually shared his CGM with me when he got it in Boston for the first time, because being a diabetes educator and healthcare professional, I do writing and I like to learn about it. So he basically set me up on the Dexcom Share feature just for information. Unfortunately, I was unaware that I would get this rather alarming alarm that would come on if the blood sugar went low. And because he's older, it's not something that he's been out of the house. I don't monitor it. I didn't see it. So when the alarm went off for the first time on this innocuous little app that I had, and it said, like, warning, Jason, blood sugar low, I think a little of my PTSD, honestly, from when they were young and had low blood sugars into some scary situations. Thank God they weren't, we got out of, we didn't have that many, but whenever we did, it was very scary. And I got the alarm, I just totally lost control. And actually, I'm embarrassed to say, I ended up calling the hospital where he worked.
Wow. Yeah, no, you were not alone.
I was trying to locate my son, the endocrinologist. And we laugh about it now because actually, as it turned out, the CGM was not calibrated correctly. He had just gotten it, whatever the case may be. I was insisting that they locate him in the hospital right away. And they needed to know, was I a patient? And I said, well, no, I'm his mom. So it was slightly embarrassing, but, it was a little anecdotal story that I have many of those with the diabetes, living with diabetes that I can tell. But they did locate him, and he was fine, obviously. But with the technology, you just have to understand how it works. And I agree with you. It was, it's good to have now, but it was also good to recognize the symptoms. And, we did control it for a long time without that as well. So,
do you mind sharing a little bit of how you did it when he went to college? Because I think there's a huge fear among families that I talk to about, their child goes off to school, whether they have a CGM or not. That seems to be a really difficult time. And just how can you share any stories or any advice about when your kids both, went off to college with no CGM?
Yeah, and it was probably, Jason being the first was one of the scarier times for me. What we did was we always had direct line of communication. We made sure that the roommates and the RAs, the assistants in the dormitories, that everyone knew the glucagon, everyone understood that he had diabetes. So the more people that knew, the better. So everyone, we encouraged that with our children from grammar school on up, letting people know this is what you do in case of an emergency. And we also would always check in on a daily basis. So we knew that everything was just okay. So it was just, give me a text, give me a call, you're off to class in the morning, just want to know. But, understanding that if they had roommates, which they did, that was really important for me to know that there was a buddy system. And also you also have to let them know that, for example, parties and drinking is a major concern. Alcohol causes a lot of problems with diabetes, especially with unrecognized hypoglycemia, so that has to be really ingrained in them. And from the time they were in high school, I feel like my boys understood that. When I'm dealing with adolescents, I really, talk to the parents and the adolescents about that, because that is also an important factor, not just the college and being away, but the potential for, getting a little, everybody, they have the beer and they have the party. So you just have to encourage communication always, I think, is important. And then for them to understand what their limitations may be.
Yeah, you need a lot of education. You can't just say, don't do it.
The diet limitations were really not bad, but the alcohol limitations, it's important to talk about, definitely.
I'm looking at the cover of your book. I'm curious, the book, we're a little late on the book, and I apologize for that. This came out last year, but I wanted to talk to you about it anyway. The cover is adorable. You've got the two little boys. Oh, yeah, looking at each other. Do you look at this picture, and in the publishing and writing of this book, you look at this picture and think, man, we did it. These two guys are, they're professionals. They're healthcare professionals, for goodness sake. I wonder what goes through your mind when you look at that picture today.
I just think, wow, the things that we got through. I I can't, that's why I dye my hair now. And but it's been a journey, but with the support of family and friends and some really fantastic healthcare professionals who we just couldn't have gotten through it without, and my husband's support, so, we all were in this learning experience together. So never thinking that would be something that would come home with me. It was like the furthest thing from my mind ever. So interesting journey, but come back to help a lot of people with our story and with all of us as healthcare professionals, hopefully being able to help people get through it.
Let me ask you about that if I could before I let you go here. As a healthcare professional, you are a pharmacist. You must see people touched by type 1 and diabetes all the time. I'm sure you don't share your story with everybody, but any advice for, those of us who are not in the healthcare field? Is there anything as a pharmacist that you'd like us to know before we fill a prescription or do anything else?
Well, I think it's important to know that the pharmacist is actually, you see your pharmacist most likely more than any healthcare professional, more than your physician. Your visits to the pharmacy are more frequent. I think what you're asking is, what can you get from the pharmacist? The pharmacist is very well educated, has a great background, and in everything that you're taking, even if it's over the counter, it's just very important to realize that if you pick something up, even if it's a supplement, something for cough and cold, it's important for you to run that by your pharmacist when you're in the store, just to make sure that it doesn't affect your diabetes adversely, and to make sure it doesn't interact with any of your other medications, for sure. But, also if you have questions, don't be afraid to ask. That's the place to get some great information. I just want people to know that there's a lot of factors involved and to take it slow. You're not going to learn everything in one sitting. Your doctor's going to send you home and your head will be spinning. You have to take baby steps and get some good information, and one step at a time. Diet, drug information, you're not going to digest it all at once, is probably the best advice I can give.
Well, Susan, thank you so much for joining me. We will link up, of course, everything about the book on the website, but thank you so much for spending some time with me. I really appreciate it.
Yeah, I appreciate you having me. Thanks so much.
I'll link up Sweet Genes, Finding a Balance, Living with Diabetes at diabetes-connections.com if you'd like to learn more. It's a really helpful book. It's the kind of book you can give to friends and family to teach them more about diabetes. I personally always like to hear more of the family's story, and I love that her son wrote part of it. So I wish there were more of that. That's my only criticism. But check it out. I will link it up at diabetes-connections.com. I just like to hear the personal stuff. You know me. Speaking of the personal stuff, let's head over to Tell Me Something Good. This week, we're talking about Type 1 Day at the Georgia State Capitol and about diabetes accessories for your Xbox avatar. Tell Me Something Good is brought to you by Real Good Foods. Sometimes you just need something convenient, right? The kids are coming home from school, or dinner's going to be late, or maybe you're not making dinner that night. It's just a great time to reach into the freezer and grab something from Real Good Foods. Their food is delicious. It's low carb. It is grain free. And it's also really convenient, not only to grab it out of the freezer, throw it in the toaster oven or the microwave. You don't have to order it by mail. The cauliflower crust pizzas, the poppers are in your grocery store or Walmart freezer. And I got the enchiladas there the other day too, the chicken and the beef. I got those at our local Harris Teeter grocery store. Now you can certainly order online. It's a great way to get mixed packs to try everything, but it is hard to find lower carb, good tasting stuff in the grocery store. I know Benny loves it. And for me, if I'm the only one eating dinner that night, nobody's home, I guess I could have cereal or a peanut butter sandwich. But this just feels more like dinner. It's real food. Real Good Foods makes it easy. Find out more. Just go to diabetes-connections.com and click on the Real Good Foods logo. Type 1 Diabetes Day has become an annual event at the Georgia State Capitol, and this is thanks to the efforts of Trip Stoner. I've talked about Trip several times on the show. She's a great friend, an incredible advocate, and boy, what a mover and shaker. We talked to her about Type 1 Diabetes Day a couple of years ago. I'll link up that episode when she explains what it's all about. But basically, this is a way that she and so many people go to the Capitol, talk to legislators, show them what diabetes is all about, and push for legislation. Things like step therapy legislation, insulin prices, CGM coverage for Medicaid, medical device options, leaving those things to doctors and patients. Tripp and another person with type 1 made a speech on the floor of the state legislature talking about the medical crisis in the U.S. of insulin prices and other drugs in the chronic disease community. They had 20 high school and middle schoolers serving on both the House and Senate as pages with type 1 diabetes for this event. How cool is that? Now, I know that there's been some talk after our episode that I said aired a couple of years ago about replicating this in other states. So if you're interested in doing that, if you'd like to learn more, I'm sure Tripp would be happy to talk to you. Drop me a line, post in the Facebook group, and we'll get you connected. I just think what she does is absolutely amazing. And I realized I mentioned step therapy, which I didn't know much about when she first brought it up. So just to explain real quick, that's when an insurance company will require the least expensive drug in any class to be prescribed first. Your doctor must prescribe that first under your insurance plan, even if your doctor thinks a different therapy is better for you. So if that cheaper drug doesn't work, well, then maybe you can go on to the next one. They call it a fail first policy. Trust me, the insurance company doesn't call it that, but they call it a fail first policy, also known as step therapy. And the advocates are saying that the doctor should be making the decision, not the insurance company. So that and many others are trying to change. Thank you, Tripp, for all you do. You still have the coolest name in diabetes, Tripp Stoner, which still cracks Benny up. You are amazing. Thank you for your tireless efforts. Again, more information on the website. Also, in Tell Me Something Good this week, I loved this. Recently, Xbox announced new avatars. You know, the player that you look like when you're playing. If you're not familiar, you sit down, and if you haven't played video games in 35 years, they look slightly different now. So your avatar, the person who is you in the game, the improvements are really great. They have avatars in wheelchairs, people with artificial limbs, a bigger variety of hair and skin tones. You know, you want representation. You want to see people who look like you. So Scott Hanselman, who, to put it very simply, is a programmer and a leader in the diabetes technology space. He's been on the show before as well. He put up a blog post recently where I'll read it here. I called two friends, my friends at the Night Scout Foundation, dedicated to open source and open data for people with diabetes, as well as my friends at Console Kings, a digital avatar creators extraordinaire with over 200 items in the Xbox store, from kicks to jerseys and tattoos. And we did it. We added our first diabetes avatar top with some clever coding from Console Kings. It is categorized as a top, but it gives your avatar not only a Night Scout t-shirt with your choice of colors, but also a CGM on your arm. He goes on to write in his blog, which is really for people who don't have diabetes. This is more about computer programming. He writes, for most diabetics, CGMs are the hardware implants we put in weekly to tell us our blood sugar with minimal finger sticks. They are the most outwardly obvious physical manifestation of our diabetes, and we are constantly asked about them. This kind of visible representation matters to kids with diabetes. It tells them and us that we're okay. You can find the Night Scout CGM accessory in a number of ways. You can get it online at the Xbox Avatar shop. And when you bought it, it'll be in the purchased tab of the Xbox Avatar editor under closet/tops. I will link this up because if you're going to go on an Xbox and get this, you're probably going to want all of the information and the links. He does go on to say, this is a beta release, and he's asking, do you want more? Do you want your avatar to be able to check blood sugar? Do you want an insulin pump? Tell us what you think. And all profits from the avatar will go to the Night Scout Foundation. I'll link it all up. I think it's fantastic. Scott, this is so wonderful. I don't know if Benny will ever use this, but man, is it great to know it is there. And when I told him about it, he laughed and he said, that is so funny and so great. So just to know that it's there is amazing. People in this community are absolutely incredible. Thank you for all you do. And give me those Tell Me Something Good stories. I have a stockpile of wonderful ones for the weeks to come, but I would love to hear yours. Tell me about it in the Facebook group. Drop me a line. I got email. I'm getting Instagram messages over this stuff. It's just great. Thank you. Looking ahead for the next couple of weeks, we've got some local stuff going on. We have our JDRF walks. We have 2 in this area. The really big one in Charlotte is just coming up this weekend. They do that at Carowinds, which is a big amusement park, like a Six Flags or a mini Disney World, something like that. So that'll be a lot of fun. We do one in North Charlotte. That's a lot smaller. That's for the community up here. That's always a lot of fun. I'm going to see if I can convince Benny to be the Rufus mascot again. He was Rufus, the bear with diabetes that JDRF has. He did that for the Type 1 Nation Summit in Charlotte earlier this year, and he had a lot of fun. But it's a little different to do that in the spring weather when it starts getting really warm around here. So I'm not sure I can convince him to put on the giant mascot suit. I'll keep you posted. The next event I have on the calendar is Touched by Type 1. That's coming up in May. That's in Orlando. And then a couple of things after that, culminating in the big Friends for Life conference. The agenda for that is out. You can see that online. We're doing our game show. We started this last year and it was so much fun. We're bringing it back. So more information about that as a listener. Even if you don't attend, you have a chance to participate. So I'll bring you more details. But I like to talk about where I'm going because I'd love to come to you. If you have your JDRF chapter, they're always looking for speakers or other events. If you have a social group or another group that, I'd love to come and talk to you. I do lots of different presentations. We can always do a live podcast episode from your area. Those are always fun. Just reach out and let me know. I would love to be part of your community. All right. Thank you as always to my editor, John Buchanan from Audio Editing Solutions. And thank you to you as you listen. We are very busy this time of year, like most people. I don't know. It's something about that March, April madness. If you have kids in school, it just seems to be a crazy time. So thanks for sticking with me. I don't see things getting any less busy until maybe summer. And I always say that, and I always have projects in the summer that I'm going to get done, and it's always busy anyway. That's just life. Thank you for listening. I'm Stacey Sims. I'll see you back here next week.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.